So first things first, nursing is not like what you see on Grey's Anatomy. Get it out of your head. Get it out of your head, okay? So hey guys, I'm back with another video. In this video, I'm going to be talking about what you need to know before becoming a nurse, because this is very, very, very important. If you guys are interested in hair care and nursing, and honestly a mix of them both, make sure you guys subscribe, give this video a big thumbs up, and also comment down below. Let me know where you're from. Let me know your thoughts about this video, and if you liked it. Without further ado, let's get right into the video. So first things first, nursing is not like what you see on Grey's Anatomy. Get it out of your head. Get it out of your head, okay? And I just want to talk to my nursing students real quick right now and just say that, like, I know that you guys are not able to do placement the way you want to. Placement looks a lot different right now, and honestly, you guys are missing out on a lot of vital experience. So in this video, I'm going to try to give you guys as much stories, as much as my own personal experience as possible, so you guys have like a well-rounded understanding of what I'm about to say. Even before going into nursing, you need to realize that, like, if you want to be a nurse, you gotta have thick skin. Nursing is not for the weak. Like, I'm not even joking. Guys, the amount of things that I have smelt, that I have seen, that I have touched, oh my gosh, like, you have to have thick skin. A lot of people drop out first year because they're like, whoa. First year in Canada, we usually have like a geriatric placement. Where we go into a long-term care home, or we go into a long-term stay thing in the hospital, and you have patient interaction. And what do? Your first year, you don't even know how to do vitals. So what are you doing? You're changing diapers. You're feeding your patients, the elderly, and that's all you do all day. But I had the pleasure of being in an actual hospital while I did it, so not only did I deal with the patients with like dementia and Alzheimer's, but I was also... Please note, everything that I'm about to say probably sounds disturbing and will definitely look disturbing, but I actually found it all so interesting, and that's what I mean when I say nursing is not for the weak. Dealing with patients who had like fistulas, which is basically like a hole in your abdomen and stuff, and we weren't quite there yet, so where we had to like pack the wound and all that stuff, but you can imagine the smells that came from a hole in your stomach going through your intestines. Ostomies. Let's talk about it. Let's really talk about it. If you guys want to be a nurse, it's actually not for the weak. Not only is the schooling also hard, but when you graduate, it doesn't get any easier. And also, even before going into nursing, you actually need to have a passion for this. Don't just go into nursing because you think, oh, you need money. You hear that somewhere in the States, they're giving people $120 an hour to be a nurse. Nursing sounds pretty good to me. Sounds good to me too. But think about it. You guys, we've all lived through a pandemic. Come on. Your grandparents, your parents, your cousins, your brothers, your sisters, a lot of people couldn't see their loved ones who were sick, dying of COVID-19. Who was taking care of them? Your nurses. Who was with them every day? Who were the only people that could show them love and care for them? It was your nurses. So imagine if you guys are nursing with no empathy, just out here to get your bag. Is that who you would want your family, your loved ones to be with? Nah, don't just go to nursing for the money. You will honestly get burnt out real quick. You need to have a passion for it, some sort of passion. I honestly went into nursing because my mom is a nurse and she inspires me. Every day my mom would come home from work and she honestly seemed so happy to go to work. And I said, I want to be happy too. I want to make a difference too. I want to smile with my patients too. And so yeah, I became a nurse. Guys, so now let's talk about schooling. So you've gotten into the program at this point. Just know that nursing is a lot of free labor. A lot. For some reason, I feel like they do start you off first year with kind of just like the basic levels of like everything. Because yes, as we go older, we're going to have an increasingly large elderly population and you're going to need to work with them. So first year was such an eye-opening experience. And don't get me wrong, yes, it was a lot of changing diapers and giving people showers and bed baths. But I honestly loved the connections that I made with my patients, the stories. If you guys are ever bored, if you guys ever want to actually build that therapeutic relationship, just sit down with like an elderly person and just ask them stories. Ask them to tell you about their life. When I tell you they have stories, they have stories. You're looking at these people thinking that they're fragile. They have lived. They have lived. And even just in asking them questions and them talking about their childhood, you can see how their face brightens up and how they become so alive. Like, just try, just trust me. But yeah, in school, it is like, it's a commitment, right? Whether you're doing the 2-year program, the 4-year program, whatever program you're doing, commit to it. Literally commit to it. Not only are you doing school, but you also have placement hours on top of that. You're actually working as a nurse as you're studying to be a nurse. It's hard, it's challenging. You're gonna have to sacrifice some stuff. Maybe you can't go to every single party. Maybe you can't go to every single trip. Because maybe the days that you would have been working, you were working for free at the hospital. I mean, it's not free, it's placement hours, but do you get what I'm saying? Free labor. It's honestly, it's hard, it's a lot of sacrifice, but it's worth it. If you have decided to do nursing, put your all into it, sacrifice those 1, 2, 3, 4 years, and just bang it out. Also in school, I'm gonna let you know now, you guys might graduate and you might not like nursing. You might be like, what is this? What actually is this? But you need to remember that this nursing degree, this nursing profession is such a vast profession. In school, the placements I had was geriatrics, maternity, mental health, community, med-surg placement, and then I did, for my 4th year, I did med-surg placement, and then I did like an oncology placement. That is not all of nursing. That is not all of nursing at all. I'm working, you guys know I work in the NICU right now, and I never even got placed in there. So I would have never even been exposed to that. There are so many jobs out there. Just finish. You will find something that you like. Whether it's travel nursing, where, you know what, nursing is calm, but maybe I can use this to also travel the world. Maybe it's community. I just want to sit at a desk, I want to chart, I want to be organized. Maybe I want to do community, but I also want to do maternity. I want to work in a clinic. I want to do like wellness baby checkups. Like, there's so many things that you can do as a nurse. So even if you've graduated, even if you're in school, you hate all your placements, you just don't like anything, just know that there are so many jobs as a nurse. You will find something that you like. This one I'm gonna say with my chest and shout it from the roof. Schooling will not prepare you for your NCLEX, for your board exams. Schooling will not prepare you for your final licensing exam. It's a mess. You're gonna need to be able to teach yourself. Nothing you learn in school is gonna prepare you for your NCLEX/boards/licensing exam. Just be prepared to do a lot of self-directed learning. You wrote this the goal. Self-taught 101. No, all jokes aside, nothing you learn in school will actually prepare you for the NCLEX. If you agree, please, I want to see you in the comment section, because like, it's a lot, so much information. Imagine having to draw from things that you learned 1st and 2nd years. You didn't even realize you had to know things in such detail. You didn't even realize that you were studying in detail, but you actually like you didn't understand the bigger picture. It was a lot. Like, and these board exams, they are testing like safety. They're not testing reality. So that's one thing I really had to get into my head. Like, this is a safety test. This is a safety and proficiency test. They need to know that you can do what you need to do safely and orderly. But they don't have all the variables and all the factors that we have in real life. It's literally like, in a perfect world, what would you do? And that's not life. That's not what they were teaching us. They were trying to teach us like real world stuff, but then we have this test that's telling me perfect world. I've never been to this perfect world. How does it look like? Someone tell me, because I don't know. And finally, when you graduate nursing, I want you to know that you are always going to be learning. You are like you're gonna always feel like you're a student, because there's always something to learn. So come in confident, but yes, be aware that the learning never stops. So even though you come in, maybe you can't do an IV, maybe you can't put in a Foley catheter, maybe you can't suction a trach, maybe you can't do these little things, it will come with time. You're not expected to know it all. Practice, advocate for yourself, ask to see it. Just be honest. People understand, especially if you're a new grad, especially if you've just never experienced it. You can be so old and be like, I've never done that before. How do you do that? Humble yourself. These are lives that we're dealing with, right? So yeah, as a nurse who just graduated, don't expect to know it all. Get used to asking questions. And remember that practice makes perfect. If you didn't get the blood work today, you're gonna get it tomorrow. You didn't get it tomorrow, you're gonna get it the next day. Do not be discouraged. We all have to start somewhere. Okay guys, thank you guys so much for watching. I hope you guys got to understand a little bit more of what it takes, what you need to know before becoming a nurse. I hope you guys understand how it looks like so that you know whether or not that's for you. And if it's not for you, that's okay. And if it is for you, welcome to the life. I did try to give a lot of examples, so make sure you guys share this video with a friend. Also follow me on Instagram if you guys ever have any questions or want me to expand on anything, give a little bit of advice. I am totally down to talk about it. But you guys gotta make sure that you guys subscribe. It helps me so much as I grow on this channel. Make sure you give this video a big thumbs up. If you made it this far, please give this video a big thumbs up. Also comment down below your thoughts. I am so excited to hear from you guys as I come up with more nursing content, and I'm just excited. Like, welcome to the club. Like, of course I love hair, it is my life, but I'm also a nurse, so like this channel is about to be lit. I'm excited. I don't know if I could say that. Only thing I chase is paper. Only thing I chase is paper. Quick length check because I love you guys. Let's straighten this out. What? Are you guys kidding me? I'm almost bra strap length. Almost. Mama would be proud of me.